Public and private hospitals are without sign language interpreters, and it's having an impact on the communication between staff and deaf patients. So how bad is it? Moy Harriet has the details.
It was a big win for Jamaica when the government passed the Disabilities Act in February 2022. 2 years later, the disabled community continues to be plagued with issues.
This is where a lot of people might disagree with me, but I feel like when it comes to disability, the deaf community tends to be the forgotten community.
TVJ News understands that most public and private hospitals across the country are without a sign language interpreter. Our news team visited a Kingston-based hospital to inquire about this. We told the nurse we were accompanying a deaf woman seeking medical help.
I don't want to say do not bring her here, right? I could not say that.
Is it that you guys have like a specific sign language person here?
No.
Now, a key right addressed in the Disabilities Act is the right to adequate health care. However,
I don't believe that we're getting the adequate provisions for the community. And when you see deaf persons go to the hospitals, often they are required to bring their own interpreters if they really want this access.
I feel like we focus on intellectual, physical a lot. We talk about ramps so much, ramps. And yes, ramps are needed, but that's not the only form of accessibility. Communication is a form of accessibility.
Damian Campbell, an employee of the Caribbean Christian Center for the Deaf, recalls the birth of his third child at a public hospital. Like him, his wife is also deaf. At first, the labor process was going smoothly as his mother-in-law was present to help them communicate with the doctors.
But when my mother-in-law left, no, my wife didn't know what to do. There was nobody to communicate. The nurses, the doctors, they started writing on paper, and that the doctors and the nurses, they're busy, so the communication was rushed, it was limited, it wasn't in full detail, so that caused frustration.
And Damien isn't the only one.
When you go and you sit and your name is being called, you don't know. So the system that is set up, it's not in line for persons who are deaf.
In fact, if a deaf patient needs an interpreter, they have to pay for the services themselves.
For the deaf person, we'd have to pay the interpreters. There should be some mechanism for the hospital or wherever we're going for them to provide the funding for interpreters.
Some medical practitioners say they are seeking to change this.
Communication will always be a challenge if our staff are not trained adequately to deal with this community.
I want it to be a continuous relationship, and one where a significant percentage of my staff are able to communicate using the sign language.
It's why a number of doctors are said to be learning the language. But
is it adequate for them to be able to communicate with a deaf person? No. Put an interpreter in a hospital setting who can't sign well is not a good idea. Recently, Damien spoke about misunderstandings. We don't want them to sign the wrong thing.
When we talk about interpreting services, we're talking about professional interpreting services, and there's a difference. We don't have that many interpreters, and we are in need of more professional interpreting.
When contacted acknowledging the significance of the matter, Health Minister Dr. Christopher Tufton said he will look into it. Moy Harriet, TVJ News.